Welcome to the Bone and Joint Playbook with Dr. John Urse, where we explore an extensive range of orthopedic topics and insights. Our goal is to help you understand the available orthopedic options and treatments available, and hopefully give you some answers to questions you might have. We want to thank our following sponsors.
Ted's Authentic Greek Salad Dressing and Marinade. It's healthy, gluten-free, and delicious. You can find Ted's in Dayton, Ohio at Dorothy Lane Markets, Health Foods Unlimited, and Dots Markets. That's Ted's Authentic Greek Dressing and Marinade. Thanks, Ted.
We would also like to thank
Stifel's GWR Group combines more than 65 years of experience helping high net worth clients consolidate, coordinate, and simplify their wealth planning strategies. The group has access to a full suite of resources to serve all of your financial needs. Email gwrgroup@stifel.com or call 937-353-2863 to speak to Guy, Brad, or Jeff Richardson. Stifel, Nicholas & Company, Incorporated.
Hey, Dr. John Urse.
Hey there, Terry.
We're back for podcast number 2 today, and we have some creatures sitting on our desk here. It's all about this creature, is it not?
Well, that would be a knee model, yes. That's what you call a creature.
Yeah. So what is the topic of today?
Today's topic is meniscus tears, trim, or repair.
Meniscus. Where does that word come from, by the way? Do you have any idea?
I have no idea. Meniscus is a little spongy cushion between our knee bones. You can see these little amber-colored C-shaped discs. They're like sponges, and they cushion and spread the force out between the thigh bone and the shin bone. And there's an inside and an outside meniscus called the medial and lateral. You could say big toe side is medial, little toe side is lateral. And the lateral is always the outside part of the leg. And there's a long history of what the meniscus has done for knee problems and what we've done as healthcare providers to address them. So I'd like to go a little bit back into what we used to do and show how far we've come now to preserve this important structure in the knee if we can, or help you get further into life, because it's an important thing to keep if we can, to prevent arthritis or to lose the cushioning effect that you would have. Think about having less of a brake shoe pad between your brakes where the discs hit and cause the squeaking and the sparks. So when you lose your meniscus and your sponge, you then have more force across the knee. The cartilage, we talked about the cartilage cushions the joint from rubbing bone on bone. And we know that when you remove the meniscus, it's not good for the knee. So sometimes it has to be done, but in history, we found some lessons, I'll say. So one of the things we learned is that people who are in coal mines crawl around a lot. And when you crawl around a lot in a coal mine, you get a lot of meniscus tears because you twist your knee and you're crawling in and out of these little tunnels. And in Wales, a certain population of the people had meniscus tears much more commonly than
Wales, the country.
Wales is in the United Kingdom.
Yeah, but you're not talking about Wales.
I'm talking about no H in that word.
Yeah, okay.
And so what happened was there was a doctor who published 10,000 meniscus removal procedures. And he said, this is what causes knee pain. The meniscus is torn. We just see a lot more meniscus tears because people crawl around in coal mines. And what you do is and everybody has a friend or a grandparent who's got a big scar on their leg where they open the knee, and they just took the meniscus out because this doctor said, I've done 10,000 of these, and this is the problem with your knee. And so everybody thought, well, gosh, that's an awful lot of experience. I guess we should do that. Well, guess what? How many times is one thing the problem with your belly? It's never just one thing. It could be your gallbladder, your appendix, your bowel, your diverticulitis. Well, the knee's the same way. So what we found is people were opening knees, taking a normal meniscus out, thinking, well, that's the thing to do, but it wasn't the right thing.
They didn't put anything in place?
No, they just said, this guy said to do it, and a lot of people did it for a while, and after a while, people were like, this knee's still bothering this guy. He had a chip of cartilage chipped off or some other problem in the knee, maybe the ACL ligament. We didn't have MRIs back then. We didn't always know exactly what was wrong.
How long ago was this?
Probably in the 70s and 60s, 1960s. So then arthroscopy, looking with a light, let us start to see other things in the knee. We then said, well, we can actually look in with a light and we can see whether one of these things is torn. Maybe they're both torn. Maybe the ACL ligament. We talked about the ACL injuries. When you tear an ACL, the knee shifts. That can tear your meniscus. So you could say, well, how do I know I have a meniscus problem?
Okay, so how do you know how you have a meniscus problem?
One thing is your knee may catch or lock. You have to jiggle it a certain way. A piece of that sponge might, if you think of just cutting a sponge on your counter and a portion of that flap flips inside the knee, it can catch and you have to jiggle the knee a certain way to bend it. It might make the knee swell. It hurts when you're squatting or stooping. It's feel like almost like having a rock in your shoe, except something in your knee. There are obviously, you've had an injury. You may have had swelling in the joint. That could be immediately, usually that's blood, or the next day or two, it could be the fluid in the joint. But a meniscus tear can be small and heal on its own. Some do fine. Other ones are bigger tears. Some are called bucket handle tears, where if you think of just a metal bucket or a pail with a handle, and the pail handle goes one way or the other, if that meniscus flips into the joint, it can lock the knee up. It's called a locked knee. And a locked joint doesn't move until you jiggle it a certain way, and then that handle flips back and the meniscus goes back where it was, but it's torn, and it can cause, a reason to have it fixed. Then we get to the point, like, which of these things need to have something done to them or not, and what do we do if we have a meniscus tear?
I would say I have no clue.
Well, you've come to the right place, because you're gonna probably see your healthcare provider.
Yeah.
They will probably do an imaging study like an MRI. They'll always do X-rays first. You want to make sure the joint isn't arthritic or just beat up from wear and tear. And if it is
this my
the
normal
meniscus
doctor?
isn't the problem.
Is my healthcare, or am I going to a specialist like you?
You will probably start with your healthcare provider. It could be a physician assistant. It could be your family doctor. It could be whoever you see. Or you could say, I know it's a knee injury. I'm going to go to a sports doctor, and I have the option of seeing an orthopedic surgeon or a sports medicine specialist, a chiropractor. Anybody that is going to plug you in can order the appropriate tests, or they'd say, we want you to go see the team doctor for this sports team. They're really good with knee injuries.
Okay,
but it's not that subspecialized. Knee meniscus problems are extremely common. Most orthopedic surgeons do a great job with them if they need to be fixed, and some do and some don't.
But can you we'll put up a picture for sure.
Yeah. So again, if we just look at the knee, you can see the meniscus is a normal structure. It'll appear green on your screen. But again, these are two C-shaped structures, and they look like a little cushion. There's one on the inside, one on the outside. There's a ligament in the middle called the ACL, and there's a stronger ligament in the back called the PCL, and there's some on the outside that are hinge ligaments. The meniscus can be injured with other injuries, and they call them combined knee injuries with a ligament injury or a bone bruise. You've had a fall, you were skiing, you were falling out of a tree stand trying to hunt a poor deer. Whatever your injury is, an MRI is going to give you information about the bones, the soft tissues called the cartilages, and the meniscus is a type of cartilage. And then it's going to say, hey, what kind of tear do I have? Is it a small little beak, a little bird beak that's a little nothing?
Right.
And if it's under half an inch, it may heal without surgery. It's not critical. Some of these just wear and tear like your sponge wears out on your kitchen counter, right?
Why can't you there's got to be something that they could stick in there as a replacement.
Well, if you have, I always tell people, if you have a sponge on your counter that has a corner ripped, and you take a scissor and trim it, it's not a perfect rectangle, but it's still a sponge.
Yeah.
So trimming the part that's torn, a small amount of it is not bad for the knee.
Okay.
It's actually all you need. And so we have procedures where a small area is trimmed, and that's called a scope. We look in with a light, and we trim a part that's torn, little basket biters or little vacuum, devices called shavers. And then we also say, well, if we actually could trim it, since the topic is trim or repair, obviously repair means we would consider fixing it if we could keep that sponge, because it's an important cushion. So that then is determined by where the tear is. So the first option is a meniscus trim called a meniscectomy.
Yeah.
We look in with a light with 2 little holes. One is a scope. The doctor looks at the torn meniscus. The other little hole has a little biter or trimmer. And that's the simple knee scope for a torn meniscus that's a small tear.
What's my recovery like when you do that?
1 to 3 weeks, pretty quick.
Do I feel? Am I home the same day?
Oh, sure, yeah. We used to put you in for 2 or 3 days. It was ridiculous.
Okay.
Yeah, there's 2 little holes. Some people don't even stitch them. You take a shower the next day or in a
Really?
week. Yeah, it's pretty simple. You do some therapy. You're not going to be playing baseball the next day, but you're going to be better. It's like taking the rock out of your shoe. Now, if you look at when do we fix a meniscus, the meniscus can be repaired if 2 things happen. One, you get to the outer part of the meniscus, and the blood supply determines whether something can heal or not. So if the meniscus is torn in its root, which is the very back attachment, then it's an important thing to repair in a younger person, and that's called a root repair. That's a little more difficult. But a common tear on the outside is called an outside meniscus or a peripheral meniscus tear where there's good blood flow. So if we took a stitch and repaired it where there's ability for it to heal, that is shown in a meniscus repair picture with different devices that deploy a little suture with a knot, and it closes just like a rip in a bed sheet.
Really?
And that can be done through a scope. You need a skilled orthopedic surgeon to do that. And then those take a little longer to recover because you have to wear a brace and protect the torsional force. Think about fixing a coffee mug handle with super glue. It looks good on the shelf, but you can't grab the handle too soon, right? Or it'll pull the bonding.
Right.
So we want this to heal. There's actually some applications of platelet-rich plasma called the PRP that we put in where the tear is to help healing. So those are growth factors. So there are times your surgeon may recommend that if they know anything about PRP. So meniscus repair is important because that gives you an upper 90% chance of returning to normal sports activities,
90%.
higher than 96, high numbers. When you repair the meniscus and it heals, that knee is happy because now it's got the cushion. Your MRI will tell you where
but how
the
do I
tear.
know if what
Your
makes
doctor will know by looking at the
injured my
MRI.
knee, I have no clue that it's meniscus or something else.
Yeah, you're going to need an MRI and an exam by your doctor or healthcare provider. They're going to say, start some therapy modalities. Let's see how it is. Let's see if you've got some swelling in the knee. And you need to know what's wrong. Once we know what's wrong, we can Google or use AI to look at some options, right?
Yeah, but if I have, I pull my knee out, walk up steps or whatever, am I immediately thinking, oh, it's meniscus, or do I think it's my knee? What?
Probably not. A meniscus tear is usually something that's mechanical in the knee. It feels like something's catching. When you squat, getting out of a car, getting out of bed, when you're twisting. We do certain maneuvers in our exam in the office where we try to see if this knee is irritated. But honestly, our exam is not that accurate, believe it or not.
Yeah.
As smart as we think we are, we're probably only right 50% of the time on an exam. Then you get an MRI, which shows you every detail, and you say, gosh, here's the problem. Well, then what do you do with the problem? We talked about possibly fixing it, which is a repair, or if it's in the root, in the back of in the very back, this shows how it's torn off the back. That root is the back attachment of the little C-shaped structure.
Right.
So that's a real important thing. Not every orthopedic surgeon does what are called root repairs, but they are very useful for restoring the meniscus. In some cases, and I'll just mention it and then not spend time on it, if you have lost your meniscus because it was shredded and you're young and you don't have arthritis, there's actually a meniscus allograft, which is a transplant. You take a cadaver meniscus and you actually put in a whole new meniscus, like it's a whole new
C-shaped thing.
And it's a big surgery. It's a 4 to 6 hour surgery.
That's what I want to know. Why can't you just
deal.
replace it?
It's a huge surgery. It's only done in the absence of arthritis in very select cases. Most of the time we can balance what's there. The meniscus is pretty strong. It's just not the only thing wrong in a knee. And that's why we don't take it out indiscriminately now on people if we don't have to.
Why does arthritis affect that?
Well, because if you lose the cushioning effect, think of the brake shoes we talked about, without the padding between the bones, think of one side of the knee having a cushion The other side has no cushion. Now the bone's rubbing on bone. That's arthritis, right? When you lose the cartilage, which is the cushion or the white stuff at the end of a chicken bone, some people call it gristle, that cartilage is the cushion between the bones at any joint. You can have arthritis in your thumb, knee, hip, shoulder, any joint, right? So I think your meniscus is an important cushion. The key would be, tell me what's wrong with my knee. Is it need anything done? Can simple things like therapy and rest help it heal? So it's a small tear. Let's see how it does. There are some places for injections, either quieting down the joint with some people use steroids. I'm not real big on steroids in knees. We do that perhaps once. Long-term steroid use in a joint is probably not the greatest thing for it. There's applications for platelet-rich plasma in the office. In some select cases, there are people that inject around a tear. But again, it's more in the sports world and newer modalities. Knee scopes are common, but there are also what are called degenerative tears of the meniscus, meaning aging and normal wear and tear, just like your sponge on your counter. It's just, you've had it for 6 months, it's got a rip in it, and it's just been used a lot. Your knees go through a lot.
Yeah, but I guess my question is, you do knee replacements.
Well, those are when you have bad arthritis.
But
and the meniscus is really not involved. The meniscus goes away. When you do a knee replacement, the meniscus structures are removed.
Really?
The ligaments are removed. Well, at least the ACL is the front one.
So all that stuff,
The ends of the bone are trimmed away where the arthritis is, the bone on bone. And the knee replacement has a metal thigh part and a shin part.
Yeah.
There's a little piece of plastic in between. Most of the time we surface the kneecap also because that's a place where bones rub. Total knee replacement is an advanced treatment of an end-stage knee problem of arthritis. This is a simple meniscus tear that can occur in a 16-year-old person who plays soccer and has a knee injury. In those cases, we want to fix that if we can at any opportunity that we think it'll heal, only if there's enough blood flow. Blood flow is important because they call that the red zone, red for blood, and the white zone is the inside of the meniscus where there's no blood flow. And just like your backyard, if you've got no water going to certain flowers, they're not going to make it, right? So you've got to have blood flow for things to heal if you're going to stitch them and expect them to recover or become a normal structure again.
All right.
Otherwise, we trim the white part, we fix the red part, or we fix the root. That's the repair part. Sometimes we just trim a little flap of tissue with a scope. And the meniscus is a pretty common injury. Everybody's heard of them. There's a lot of information on the internet. You know, they're not always emergent things that have to be done the next day. You don't drop what you're doing to go have a knee scope. It's based on your
is it expensive?
response. Most insurances cover it. I think around the world, it depends how they're approached. I mean, insurances have to approve the procedure. You have to say, I tried getting it better with therapy or rest. I have an imaging study that proves it. I got to get back to my sport. I'm in the middle of my season.
How many of these would you do in a week or a month?
The average orthopedic surgeon would do probably 5 to 20. Possibly, depending what their practice is.
Yeah.
It's really common. I mean, knee scopes are probably the most common arthroscopy we do, meaning looking in a joint with a light.
Yeah.
Shoulders are probably next. We talked about hip scopes. They're less common. Ankles and wrists and elbows down at the bottom. So I think your average meniscus surgery is probably one of the more common things we do in orthopedics. It's a relatively, I don't want to say simple procedure, but it's pretty gratifying. I tell you, like taking a rock out of your shoe. I mean, it's usually you walk better afterwards, right?
Yeah. Okay. Well, hey, is there anything we left off this?
Well, we want to thank our sponsors. You know, Ted's salad dressing. It's an authentic Greek dressing.
We should bring a jar and put it on.
We should. And then we do want to thank Stiefel Nicholas Group with Guy Brad and Jeff Richardson.
Bring a bag of money in.
They're great financial. Well, maybe they would just show you what to do with that money. But we appreciate our sponsors. We also want to thank Terry at Tri-Level Recording for doing a great job on our productions. And make sure you like the Bone and Joint Playbook wherever you listen to podcasts on social media or on YouTube for the videos.
All right, folks. Thanks again. We'll see you next month with the Bone and Joint Playbook with Dr. John Urse.